Does the healthcare system need to change in order to stem this resistance problem, which is a global problem? The answer is yes, it certainly needs to. And one major way that this can be accomplished is by educating our healthcare practitioners and patients to follow some very simple but specific guidelines. Very important. What are those guidelines? Number one, and you would think this would be obvious, but it's still a problem today. As a physician, a healthcare practitioner, don't overprescribe, particularly if you don't know the pathogen that is causing the infection. Is it viral? Is it bacterial? If it's a viral infection, you can pump antibiotics into the patient. It will do nothing, but it can cause resistance, and it can spread resistance. And very often a patient walks into a doctor's office, particularly parents of kids. I'm not leaving here until you give me something for my son, who is very sick, perhaps virally. Don't do that. Don't overprescribe. Number two, if you do prescribe, choose the right antibiotic at the right dose for what you suspect is the offending pathogen. If you don't know what it is, culture and find out. Okay? The right choice is critical. Okay? If there is a choice, choose one that kills, rather one that just inhibits growth. Because if you choose an antibiotic that kills, the chances of resistance coming are less. It's the ones that only inhibit growth, and you have residual bacteria that are not growing, they're sort of dormant. Okay? Antibiotics that kill don't have that problem, but antibiotics that inhibit growth do have that. And again, resistance can arise. Okay? Fourth, I mentioned this before and I'll reiterate it again. The patient goes home, fills the prescription, takes the antibiotics. Usually antibiotics are prescribed for a course of 1 week, maybe 2, typically. Okay? The patient will feel better probably within 2 days, maybe 3. Will feel better. Symptoms may go, but you cannot stop. The patient must take the drug all the way, every single pill in that bottle. And lastly, the healthcare community will have to start to recognize the power of combinations to treat bacterial infections.